Welcome to Empowered. I'm Elizabeth Namofsky. Our teeth are important to us. Not only do they help us eat and start the digestive process, they mold our speech, give us our facial profiles, and our beautiful smiles. Now, what we don't think about is how stress plays a role in the health of our mouths, that some oral conditions are actually linked to hormonal changes, and how much your mouth affects the health of your body. Today, I'm joined by Dr. Willa Chu. She's a dentist at the Concourse Dental Centre in Toronto. Today's focus is unique dental concerns for women, meaning a healthy mouth equals a healthy body. Dr. Chu, welcome to Empowered. Thank you so much for being here today.
Thank you for your invitation. Looking forward to it.
I am too. And I have to say, in the olden days, I remember my mom telling me that, nobody really wanted to go to the dentist. They came over from Yugoslavia at the time. And, when you went to the dentist, they would yank your teeth. Why do people avoid dentists and dental work?
I think personally, from stories like that there's a lot of pain involved. Number one, because back home they didn't have a lot of anesthetics. I think the pain factor is a huge thing. And people don't usually come to see us unless they're in pain, which makes the procedure harder because we're trying to get them out of pain, that we cause discomfort in doing so. I think for a lot of us in the economy that we have now, if you're not on a dental insurance plan, the price is a problem. But now with the government plan, hopefully a lot of patients will now see, well, patients that are eligible will see that there is help for them, especially the seniors that find it really difficult. The other thing I think is the perspective of dentists. There's a lot of media out there that just make fun of us. We want to have the fancy cars, the fancy homes. So it's more of a business as opposed to healthcare. And I think we need to change that perspective for patients, right? That it's important more than you think. I mean, it is healthcare first, and above anything else. So we have to take care of the body.
So let's talk about the functions of our teeth. I mean, we all see them when we smile, but what are the real functions?
Well, teeth serve, number one, the smile is a big factor. A lot of studies have shown that people that don't have good smiles, they don't show confidence. They don't go out and create opportunities. They're very shy. They're very withdrawn. So smiling is a big factor. Number two, the teeth help with your speech. If you remember when you were little and you lost your front teeth, you couldn't really talk very well, right? Because you have a lisp. So it does help with speech and phonetics. Teeth also help you break down your food. So that starts the digestive process. So if you're swallowing chunks of food, which a lot of seniors may do because they have dentures and they can't chew their food, you're not going to absorb the nutrients very well. So from that perspective, teeth are vital to help just break down food into manageable portions for your digestive system. The other thing is a lot of people that don't have teeth, they realize their face kind of gets this sunken in look. And it affects just the way you look, right? So some patients with dentures, when they take the dentures out, they're very embarrassed by how they look, so they don't take their dentures out, which then cause other problems. So teeth are more than just, things that look good on TV.
So let's talk about the three most common human afflictions.
So it's interesting that number one, common cold, because across the world, everybody gets a cold. And across the world, everybody gets cavities. And the last thing is, across the world, everybody gets gum disease. So number two and number three, the cavities and gum disease are the dentist's territory. So because, number two and three of those afflictions, people should go see a dentist because we're the ones that will help you with that.
So before we go to break, I want to talk about plaque. Why do we need to clean it off? And what is tartar? And what's the big deal with it? Why do we get it?
So if you think of plaque, it's a moving mass of bacteria. So they say that there's over 100 million bacteria in a little clump of plaque. And in there, there's about 500 different species of bacteria. So when you see plaque in your mouth, it is just multiples of colonies and colonies of bacteria. So it's like seeing ants on a sidewalk. You see one ant and another ant, and then soon you see this big moving brown mass. So when plaque stays on your teeth long enough, it is actually microscopically a moving mass of bacteria. So when you think about that, at the end of the day, after you've been eating and feeding this mass of bacteria, the food and the bacteria create this fuzzy material on your teeth.
Dr. Chu,
And
hold on to that fuzzy material in your teeth. We'll be right back with more Plaque Talk.